Hello everybody, my name is Bonnie and I'm going to be giving you a presentation about oral cancer. I'm going to put you in question and answer
All
mode.
attendees are muted and may unmute themselves by pressing *6.
And so what I'm going to do is I'm going to send a chat of when, let's see, send to everyone, remove this box. And when you can hear me, give me a thumbs up. Okay, so I'm going to do that. And so we're going to start with a poll. I'm going to have you take this poll. Do you know anyone who has or who has had oral cancer? So we're going to do a vote. We're going to submit that. So thank you for your poll. And so we're going to see our presentation. So we're going to get started, making sure that everybody is got their microphones tuned in. Up here under My Mood, it gives you these four signals that you can give to me when you can hear me. Also, I'm going to ask you to go to your private chat and answer this question. What do you think or know are the top 2 contributing factors for oral cancer? And you can answer those in here, and this little second icon is its individual private chat. Go ahead and do that as before we get started. So we're going to be talking about oral cancer. The contributing factors. The 2 most important factors for cancer is the use of tobacco and alcohol. Smoking is the single most important risk factor for oral cancer. Most oral cancers are in older people, most of it mostly men. There are women who do get oral cancer, but it does affect the man as a higher percentage. And when you have smoking and alcohol mixed, it causes a synergizing effect, because what happens is that the alcohol causes your mucosa, which is your cheek lining, or your vestibule, which is down along the insides of your teeth where your bone is. It causes that to become dried out and more permeable. And then the tobacco causes constriction of blood vessels, as well as you don't get the right supply of blood and oxygen to those areas. And then that changes how the tissues regenerate. They generate what we call atypical. So if you ever go to get a diagnosis where they take skin cells from those areas that we think that might possibly be cancer, then what they do is they come back as times where it's like precancerous or atypical. The next one is smokeless tobacco. Here in the Southwest, there's a lot of people who do smokeless tobacco, and I actually have, as a clinician, I have probably 5 people that I could count on my hand that are right now at this time 14, 15, 16 years old, and they've already been dipping for probably 2 to 3 years. And it's just amazing, you know, that they'll at least answer yes to me because they know that I'm seeing something. And they're all like, well, are you going to tell my parents? You know, that's kind of a fine line. So I tell them, well, you're the one doing it, you're going to be the one to tell her. You know, as a clinician, And just as a parent, you know, the HIPAA rules are tremendous. You know, there's a lot of issues there, and sometimes you can't tell people about their kids, even though they are 14 years old. Cancer of the lip is generally heavy exposure or excessive exposure to the sun. And you know, we live here and we have a lot of sun, so it's really important that you use a lot of sunscreen on your lips. You know how to, you know, wear your hats and stuff. That does help that. Poor oral hygiene, nutritional deficiencies. There are specific viruses that are related to the HPV, related to oral cancer. HPV is called human papillomavirus. It is a sexually transmitted disease, and right now you can know it as one less. The commercial tells you to get your daughter vaccinated between the ages of 9 and 20. And that's actually before she has a lot of exposure to HPV. The actual virus, the virus strands number 16 and number 18 are what are found in the cervix. Cancer of the cervix is a high number because our children have a lot, I mean, sexually transmitted diseases is way up on the chart. And so there's becoming a different type of oral cancer profile. I would say a profile. You know, it used to be the older men who dip and smoke, and now it's becoming the younger man, and it's because he's having contact, either oral or anal sex, and then you also get you can get genital herpes with that as well, and that those wart-like appearances can appear in the throat. Also with acquired defects of the immune system, whether you have an autoimmune or your immune system is compromised, and that comes with nutritional deficiencies, it comes with poor oral hygiene. And so here's some images. Sometimes this is leukoplakia. This is a white patch lesion on this tongue. It is a cancer, and most of these patients here are within their 40s. There's a lesion right here on what we call the posterior pillar or posterior tonsillar pillar, and right here on the tongue, this is erythroplakia, which is a red patch. Erythroplakia actually has a higher rate of developing into cancer than the white, the leukoplakia. Here's some signs and symptoms for clinical diagnosis. Most oral cancer in the early stages, it goes unnoticed. People aren't paying attention. You know, they pay attention to stuff on the outside, but just like brushing and flossing, you know, it's like, oh no, it's okay if I bleed and what we call pink in the sink, but really it's not. So most people aren't paying attention, and so they need to be knowing that oral cancer, it goes unnoticed just because it can be really small, and most often it has no symptoms, and it can be very little physical change in your tissue. And like I said, it can be white or red, leukoplakia or erythroplakia. Some more signs and symptoms is a small indurated ulcer, like a canker sore. It can be hard. Indurated is hard. It's you can have hoarseness in your voice for a long time, or you can have numbness in the oral facial region. Persistent earache as well. I'm going to introduce you to a woman named Eva at the end of this presentation, a link that will take you to her, and she's going to tell you about her cancer and her experience with a canker sore that would not go away. But thank goodness that she actually was very persistent to the doctor. So with detection, we want you to give an oral and an extraoral examination. Intraoral is where you're looking inside your mouth. You need to palpate with your fingers, move your tongue back and forth. And extraoral is feeling behind your ears, under your jaw, and behind your neck. You're looking for any kind of swellings, also radiographs or x-rays. You know, if you're not diagnosed right away, usually it is attributed that you will not go see your dentist or your hygienist. It can be on the professional as well. Be sure that you're giving your oral cancer screenings. Teach the importance of the oral self-examination and how and when and why you want to see your doctor. It is the most important to have the sore or discolored area of your mouth that does not heal within 14 days. You need to have it looked at. So here's some links. I'm gonna first and foremost make sure you're seeing your dentist regularly or your hygienist. Monthly self-check exams. This YouTube link will actually give you talk through the whole intra and extraoral examination. The next thing is to quit smoking and stop drinking. I know they say drink in moderation, but yeah, right. So here's a stop smoking link. This is a really good, they give you a lot of help and they give you products. Alcohol withdrawal, they give you some symptoms that if you're really having a hard time, that's one that you'll need to be, that gives you some signs that will help you to recognize if you're having an alcohol issue. Okay, so I'm going to go here to this link. There's a link that's right here, and it's going to open up, and she's going to sing to you a rap
Latte
song.
or Olay? Cozy?
And we're not going to hear that right now, but that does give a link. And so, and here's another link, and we're going to do a screen share. And I'm going to show you my Google Drive. I did do a drawing, so what I want you to do is indicate with an arrow where you think would be a site for the most common type of oral cancer. And so I did show you a few things and a few places that would be on there. So we're going to stop screen sharing. And so also I have my little document again, my application. This is my YouTube drawing. And so I'd like to stop this with a poll. So we're going to start voting. Does this presentation inspire you to take action in the prevention of oral cancer? So we're going to say yes. And we're going to submit our vote. I thank you very much. I needed to share my link with you. So I'm going to do copy and paste. Well, not so much. Sorry. Here we go. Share. There we go. Now, here we go. So I'm going to type that link here, and then I want you guys to go ahead and go there, and I want you to copy this link and put it also, this link right here, to that way you can watch her oral cancer rap. So thank you so much.